Good weekend. Welcome to Leading Edge. I'm Jerry Anderson. I hope your Memorial Weekend is a fine one and that you take time to remember those we've lost in the service of this country. Ahead here, he says he's the best football player you've never heard of. He also says God talks to him. And what he's here to talk about is what God said and what this man now does because of that. But up first, it used to be the stuff of a vocal but passionate fringe, this talk of Medicare for all, a single-payer health care system. But don't be surprised if it's not part of the Democratic Party platform next year and may rank up there with immigration, abortion, what else do we have? Trade and tariffs, even obstruction in next year's presidential political discussions. One of the voices leading the single-payer discussion is that of Dr. Johnathon Ross. I want to say retired medical internist. Did I get that right?
That's correct, Jerry.
All right. Now, Doc, many of us see government, all right, and historically I have, at least the feds, anyway, when we talk about that level of government, it's kind of bloated, wasteful, inefficient. Okay, we need national policy on things like defense, probably the environment, interstate transportation by road or air, but we don't want them managing our health care, do we? Plus, isn't that socialism? And we're card-carrying free market Americans. Biggest issues, I think, quality of care and cost of care. The quality of medical care in America is second to none. Is that a correct statement? Why or why not?
Sadly, Jerry, it's not. If you actually want to compare ourselves to the other wealthy industrial democracies, the Organization for Economic Cooperation and Development, which is mostly Europeans, Australia, Canada, a number of others, Japan, our outcomes are actually to the bottom of those. On some of them, they're almost second or third world, especially our maternal and child mortality. So our outcomes are not the best in the world. We have the best doctors, the best nurses, the best equipment, the best doctors in specialties.
Okay.
We've got some of the worst outcomes for what we're spending the money on.
Okay, and that at the end of the day, if you go to see a doctor, you're worried about the outcome. Is it going to make me well? And when you talk about that doesn't hit home to those of us here in Ohio, and especially Northwest Ohio. Infant mortality is a huge issue right here at home. So tell me, Johnathon Ross, how would this single payer, Medicare for all, how would this improve then the quality of our health care, given if we've got the best doctors, the best equipment, all that stuff?
Yeah. I think what we lack is a system to bring care to everybody who needs it. And so what we're seeing is, especially across racial lines, across wealth lines, we're seeing people who aren't able to access the care that we are able to provide them, and they end up sicker, they end up with worse outcomes. We've got almost 30 million Americans without health insurance at all. On top of that, we have another 40 million Americans whose coverage is so poor, it's almost like an umbrella that'll melt when it rains, because their deductibles and co-payments are huge, and they don't go to the doctor in a timely manner. And we've got lots and lots of evidence to show that those high out-of-pocket payments are inhibiting people. So when you've got 70 million, almost a quarter of Americans who are really not able to access care, your outcomes are going to be pretty poor.
Okay, we've just scratched the surface there, but I said we'd talk about quality and cost. Let's broach that. On cost, our federal deficit, as you know, climbs by billions annually, the debt measured in trillions. There's no way we can afford to pay for everybody's health care, or is there?
Well, everybody else is doing it. All those other countries who have better outcomes are doing it. What we have to do is to actually look at what are some of the fundamental things that are wasteful within the system. And what I can tell you is that our administrative costs for our healthcare system are double almost all those other nations, because they decided that healthcare should be a right for their citizens, decided to come up with the simplest, most straightforward ways to make sure everybody can get that healthcare. So when you actually look at the percentage of their gross domestic products or their dollars spent per person, they're substantially below what we're spending.
Dr. Johnathon Ross just was published an op-ed piece over in the Cleveland Plain Dealer, I believe, earlier this month. I want to take a look at a couple of things that just for us to chew on, because I know some of you out there saying, Jerry, you're not going down this road. Yeah, I'm going down this road because as I age, and the healthcare system we're in right now, I don't want to say it sucks, but it's not working to its fullest advantage. And we have this proof around the world. For example, costs are out of control. Outcomes of care, just talked about, mediocre. Access to care, more than 25 million uninsured, 50 million uninsured if the ACA is totally repealed. And then get that second slide ready too, because the doc just made reference to the administrative costs of this thing. I want you to take a look at this. Administrative costs, on the left there, the current system, a public plan option in the middle. And then that shortage by hundreds of billions of dollars would be a single-payer system.
Yeah. Here's what the Europeans do in many other countries. They actually budget hospitals. The hospitals, I worked for St. V's for years, and they have to produce a budget every year. I was part of that budget process for the clinic that I was director of. And so once that budget is formed, why couldn't we give, if it's a legitimate budget, overseen publicly with openness, that the budget is legit, why not just give them 1/12 of what they need every month and no more billing? And then everybody's covered, because if you need to go in the hospital, you go in and you don't have to worry about it destroying your family. And that's what most of the European and other rich democracies do. Some of them do what Medicare does now, which is to pay on a per case basis. But the simplest thing, if you want to eliminate the overheads for the hospital, is you go to a system where you budget. Now, that's for operations. The other thing we have a problem with is the building, I call it the edifice complex. We have more and more buildings around town.
Yeah, I've noticed.
So part of the problem with that is there's no public accountability for it. And yes, some of those buildings are probably necessary, but I think probably the public ought to be able to take a look at it and have some say-so, since they're ultimately going to pay all the bills for the new buildings that we're building.
Tell me about the 209 economists who weighed in on this issue. Try to get economists, by the way, to agree on anything.
Right. I thought it was kind of funny there. The joke is about find me a one-handed economist.
Yeah, because economists always say, well, but on the other hand, I got you.
We've got 209 of them who all said that, this is a real idea that can really work and that we should look at it. It's odd. I mean, we're going to be the last rich country to get to the point where we cover everybody. And one of the advantages we actually have by being last in this particular situation is we could actually go to school on all these other countries and have them say to us, no, don't do that. But, this is really working well. There are
Learn from what other people have done.
Absolutely. And we're so parochial, we think that we're the only smart people on the planet, and Lord knows we're not. All these other rich countries have figured out how to do it and to cover everybody and to give a higher level of quality of care, better outcomes at about 2/3 the cost, even at the most expensive luxurious
2/3 the cost. So some of you are saying, Jerry asked them the question, how much will our taxes go up? You are suggesting most Americans, not all, most Americans will pay less for health care. Make me believe that.
All right, so here's what's going on now. If you've got employer-based insurance, they're taking money out of your paycheck, that's your portion, and the employer is paying the rest of it. They could have given you the money. Now, the reason it doesn't work out that way is you get the tax deduction, and that's good, especially for really wealthy people, more than it is for ordinary people. But for the bosses of these companies, it's still a good deal for them. They get their health care at a significant discount. Now, imagine instead of that, you took the very same money and you paid a tax instead. So I'm going to take money from you, $10 out of your pocket, call it a premium.
When I worked at this television, I'm not an employee now, I have my own company. Well, I worked here, I looked it up. Every paycheck, we got paid every other Tuesday. You guys still get paid on Tuesday back in those days? Over $300 every paycheck was going, and that was for my wife and I.
Yeah.
Well, that's $600 some every month, and if somebody said we're going to raise your taxes that much, Jerry would be like jumping around, so you can't raise my taxes. Well, what if I just took that and put it into a pot toward health care?
Who cares what we call it? Call it a premium, call it a tax.
Yeah.
The efficiency of the IRS, I don't think, can be particularly questioned. I mean, they're very good at vacuuming my pockets every April 15th. I don't know about yours, but we don't have to hire a single additional person to actually collect that money into a single pool. So we could control capital expenses for hospitals by having some public oversight, so we don't have an MRI in every corner or a hospital 10 feet from each other like we do in this town.
I have much more I want to delve into. This is Dr. Johnathon Ross. I think this is fascinating stuff in a discussion that we ought to have. I think we absolutely will have. You're going to hear more and more of this as we head toward November 2020. I need to take a break. You can hang for a second?
Yeah, sure.
I'll be right back on Leading Edge.